The Gambia's Minister of Health has expressed frustrations on the behavior of staff at the minister in regards to the COVID-19 funds. His revelations came in reply to the National Assembly members on the lack of timely allowances for the frontline health workers. The allocation of emergency fund to fight the COVID-19 has been a cause of distraction, according to the Minister of Health.
The Gambia's Minister of Health presented before the National Assembly a scenario of systematic corruption in the face of national response to the COVID-19 global pandemic. Dr. Ahmed Samate spoke in response to the cause for delay in allocating allowance for frontline health workers by the Ministry of Health after 2 months into the outbreak of COVID-19 in the country. Government of the Gambia allocated emergency fund of $500 million to contain the spread of COVID-19, but the health minister described the aftermath of this allocation as beginning of a shift in agenda from the COVID-19 to money.
Just come to the bear, and if you don't deal with it, there is disaster. So you end up having to deal with that. This allowance issue is very unfortunate. Government came up with the idea that, and as we've been saying ever since, no one can ever pay health workers enough, especially frontline health workers. When people are sleeping, when people are doing other things, when people are enjoying, celebrating, these frontliners are at front there, risking their lives to provide health care for our people. But government said, let's give them honoraria, just a token to say thank you very much. Now, this honoraria, we said, provide us with the list of the people who are at the front line. The problem started, unfortunately, especially when the 500 million was announced. That's when our problem as a health ministry started. Unfortunately, people start to even forget about COVID.
The Special Select Committee on the Implementation of the State of Public Emergency had in its report that the lack of payment for frontline health workers is the situation in almost all health facilities across the country. Dr. Samate drew the attention of lawmakers to his frustration on the reaction of civil servants at his ministry who appeared to employ all means to suck from coffers of the coronavirus emergency packages. Administrative scrutiny, he said, exposed the reality of ghost workers and duplication of names for the purpose of harvesting the COVID-19 funding.
Of course, we wouldn't accept that. We said to them, it's a non-starter. It went back. They brought another list. That list was so big. We say, where are these people? I said, okay, if this list is big, bring it, let us have a look. We looked at the list. There were names of over 300 volunteers. Nobody knows where those volunteers. That means they are not working in the health sector. So if they are volunteers, now that also went. We said non-starter again. Remove all the volunteers. Bring the list of the core people. The list of the core people was brought. Some people came together to say, we know the people who are the active players. That list came. We saw names appearing in one section and another and another and another. Then I said, no again. Took the list back.
Dr. Samate shared a report of a young nurse who discovered that health workers were busy posting themselves to places they thought would attract larger allowances when the ministry decided to apply stratification measures. He said the young, smart and honest nurse reported that he was shocked by the fact that the emergency room is filled with workers who were ordinarily posted to other places after knowing that those in the emergency unit will receive more money based on the degree of risk they bear. The health minister argued that this nightmare is as a result of corrupt system with whose enablers are inherited by the new dispensation. The second extraordinary session of the National Assembly was convened to, among other things, debate the extension of the state of public emergency for another 45 days. For Air Africa News, I am Lamin Sane.